As the U.S. races to vaccinate against the coronavirus, some women are skeptical about getting the vaccine while pregnant. But a new report in the American Journal of Obstetrics and Gynecology says it's important that expectant mothers are vaccinated against the virus. According to the report, pregnant women infected with COVID-19 face more complications. Dr. Frank Chervenak authored that report and is the chair of Obstetrics and Gynecology at Lenox Hospital in New York City. He joins me now. Thanks very much, Doctor, for being with us. Is there any evidence the vaccine can harm pregnant women or their unborn babies?
No. The reality is that this is one bad bug. COVID, whether you're a man or a woman, can kill you. For pregnant women, we know that the immunologic state is deficient, and as a result, the reality is that they're more susceptible to death, to admission to ICUs, to going into premature labor, and having all sorts of complications of pregnancy. So it's something to be avoided for both the mother and for the fetal patient. We don't want them to be affected during pregnancy. There's no evidence that this harms the woman, and there's no evidence that it hurts the fetal patient. mRNA does not enter the nucleus, so there's no evidence that this is indeed harmful to either the mother or the fetal patient.
Well, your report noted there are some, quote, transient and treatable risks associated with the vaccine. Can you elaborate?
Absolutely. I myself have had 2 doses of the vaccine. I had a little bit of pain, a little bit of headache. Please, this is a small price to pay to be immunized and not to have a risk of death and severe complications. What galls me is the fake news that's out there and the misinformation that's out there, not just for women, that men, that this is harmful, that the vaccine can cause infertility. This is garbage, and women are entitled to know the truth.
Well, why are pregnant women considered a higher risk group for COVID-19 infection?
Excellent question. As you can imagine, when a woman is pregnant, she's carrying another person inside of her, the fetus. It's immunologically different, so her immunologic state is depressed. So as a result, when this happens and a severe infection occurs, whether it's a flu or COVID-19, and it hits her, she can be affected much more severely. And we know this. There's evidence out there. If a pregnant woman is affected with COVID-19, she's more likely to die.
Right. And what are some unique complications that pregnant mothers face after being exposed to COVID-19?
They are more likely to go on a respirator. They're more likely to go into premature labor, to have preeclampsia, and to go into a heart-lung bypass machine. Bad things. And as we know, COVID can hurt anyone. I lost one of my doctors due to COVID. But pregnant women are even more susceptible, and that's why I strongly recommend to pregnant women that they accept the COVID-19 vaccine. Forgive me, some of your listeners may be familiar with Willy Wonka and the chocolate factory. It's as though they're getting the golden ticket. They should take the vaccine as soon as it's offered.
Your report also says it's important for women who are planning to become pregnant to get vaccinated, but the vaccines are not widely available just yet. Would you advise your patients to wait to get pregnant until they are vaccinated?
Absolutely not. As I said, if the golden ticket is offered to you, take the vaccine as soon as possible. It is so sad that right now, pregnant women are often not in the priority grouping. One of my colleagues, Professor Grunbaum, has shown that 36 out of the 50 states do not consider pregnant women a priority, even though they should be a priority. And as a result, they may be delayed in obtaining the vaccine. So my strong advice for anyone considering getting pregnant, or who are breastfeeding, take the vaccine as soon as possible. Grab it.
Dr. Frank Chervenak, doctor, thank you very much for your time.
Thank you so much for this opportunity. And I truly hope that the women who are listening to this, please be empowered to do what's best for themselves and their soon to be born children.
All right. Thank you so much, doctor.